Hello there, how you doing? Welcome to Total Immunology again. My name's Ross. Remember, I'm a consultant scientist for immunology in the NHS in the UK. And today, on this episode, we're going to be talking a very generic question, which is going to be talking about what does a healthcare laboratory do? So the first thing you may be wondering is why am I using the word healthcare laboratory? And I could be using two other words. I could be saying diagnostic lab or laboratory, or I could be saying pathology or path lab. And I don't believe those words are the most accurate to reflect what a healthcare laboratory does, because they do more than find pathology and they do more than diagnose. And so I want to go through that in this episode very quickly to just go through how healthcare laboratories fit into today's healthcare process for patients so that it can be understood what they actually do. So you'll see that we have to first of all think about what is the situation with regards to why a patient would either come into the system in the first place. So, what are the reasons? One reason could be that you've got a pain and you're feeling a pain on some part of your body. Another reason could be you feel terrible. You could be feverish. You could have a really bad head. You could just feel like you can't concentrate. The other reason might be you look awful and you don't look correct. There could be an appearance difference about how you look. Now, the reality is that there are other things about your feelings. You might, regardless of all these things, feel overwhelmingly happy. You might feel overwhelmingly sad. You might feel cold or hot. You might feel incredibly tired or sleepy. So there are lots of different factors here that the patient can exhibit right at the very beginning of why they may even go into the system. And one of the things we need to understand about the healthcare system today is it's not always been like this. If we go back in time and stretch right back into time, we've always had the idea of individuals who are going to be thought of as the people holding the knowledge to make someone better or deal with them. You can go to different cultures and different time points of the world and find many different iterations of this. If we stick to the traditional Western Europe idea and go back over the last 100 or 200 years, we had a big period of time where we used to have esteemed individuals. Unfortunately, most of the time they were male, and they would be considered experts of their field, and they would have been able to say, I believe that the answer is X, and I'm basing that on my experience and my wisdom in the field. And I almost don't really need to justify it. It's me who said it. I've said it, so therefore it should count. And we call that expert opinion driven medicine. And I don't want you to think that's disappeared. That hasn't disappeared. That still exists today. But the difference is that we've moved on from that being the sole driver for how we make decisions in healthcare, okay, particularly about a patient and their further management. So, how has that changed now? It's changed because of us now having the technology and the capability to be able to collect data on the patients to a higher degree. We're able to get a better understanding of the patient other than the clinical examination we would do on the patient on the day. What do I mean by clinical examination? I mean looking at what they look like, how they feel, where it hurts, where it doesn't hurt, maybe the color that they exhibit and the kind of history of how the symptoms developed and for how long they persisted and how often they get them, etc., etc. Now we have the ability to take a sample from the patient and be able to measure that sample and look for particular things, find evidence about that patient to understand what could be the cause of that. The other option we have for collecting evidence is to be able to take different pictures or take imaging of our patients to be able to see, can we notice something that maybe we couldn't notice from a traditional clinical exam, to give us better data, better accuracy on what we feel. We put this together, and this is called evidence based medicine. This is about producing objective data, just hard facts about our patient, which allow us to guide our decision making. So let's put that into our patient flow of healthcare systems so we can now see how things work. So we need to understand how patients move through healthcare systems. Patients either enter a healthcare system, first of all, by going to a GP. This is what we call primary care. They go to a GP, they make an appointment because they don't feel quite right, but they don't feel so serious that they need to do the other option, which is going to acute medicine. The word acute really just means immediate, urgent, and they need to see someone very quickly because the symptoms they've got are so significant that they need to have care straight away. GP appointment, you might get it the same day, you might get it maybe in a couple of days, and it's going to be a sit down at the very beginning. So it's a much more relaxed process. So we put those things as our kind of first encounter with the patient. Now, if we talk about the GP side, you may go and see the GP and have a chat with them, and they may offer you some sort of treatment, some sort of fixative that they can give to fix the problem that you've presented them with. That could be a drug, it could be, in this case, a plaster as a symbolic gesture of that. They may say to you, actually, I think you need to go into hospital and you need to go and have another investigation done in secondary care. Okay, so secondary care means going into a hospital to see a specialist team of people in order to have further investigations done to help try and understand. So there you can see treatment and our hospital appointment. Now, the other option, if we take the acute medicine prospect, is we could have a situation that says now you're in hospital, you're an inpatient, and you're going to be treated and looked at. And ultimately, that could result in you needing to have major intervention performed. That could be in the form of surgery. It may mean that you need to go on medication. We need to give you medication and drugs very, very quickly. So when you put these all together, you can see that we have secondary care as our next phase. And you can see that if you go into the hospital appointment from the GP, that can also end up with you needing a procedure or needing an intervention or a drug at the same time. So there are many ways to flow through this system. We've got to eventually leave the hospital. We can't stay in the hospital forever. And there are unfortunately two ways that can happen. Well, one way is very nice, and that is that you're going to leave and go back to your family, go back to your community. And unfortunately, the other way you're going to leave the hospital healthcare system is because you're going to die. And so we can put those into our flows as well. And you can see that one of the most important things about this is if you move into your home or community setting, that often isn't the end of it, because what's going to happen is you may have to go back to your GP, and you can see that arrow leading all the way back up to the top in the GP. That's where you're going to go back to the GP. That might be because you have a completely brand new set of symptoms. It's very common for a patient to have more than one challenge going on, okay? And we call these comorbidities, where there is a build-up of additional problems or challenges that the patient is going through at that time and adds together. We may have the original problem that we have first encountered on our patient. And you can see I've got two arrows here moving between hospital appointment and the home community. And what we've got here is the idea that we're going to keep going back to secondary care to our specialist team to revisit. Now, where does the healthcare laboratory fit into this? Well, we do have to acknowledge that diagnosis is an important part of what a healthcare lab can help with. And that is the idea that says, we've got a problem with our patient, they've got symptoms. Can we try and understand what is wrong with them? Can we do necessary screening? So, screening means that we're going to perform a set of tests to effectively rule out a common illness that we think may be associated with a certain set of symptoms. So, we may say we want to screen the patient for an infection or a particular condition or disease because the symptoms they're presenting, a common finding is that that disease could be the cause. We may do that at the GP point. We may even do that at the acute medicine point when someone rushes in. And the other option we may do is we may do it when the patient enters on the hospital appointment in secondary care. The other option is that the patient has got a very clear finding. We now know what is causing the patient a problem, or we found a problem on the testing. We've now found something that looks weird, looks abnormal, shouldn't be there. It's not there in healthy people. So now we have to understand how serious that is. We may have now reached a conclusion that a patient does have a particular condition or disease. And so now we need to understand at what stage are they at that disease? Are they at a stage which means they may have to have very serious drugs or very serious surgery because otherwise they're going to die very quickly? Or are they at the very beginning of this process and we've discovered they have this disease at a very early stage? We call that prognosis. Okay, so it's about the idea of saying we understand what is the potential future progress of this disease and the pathway that we're going to see, and where does that patient sit. Another way of thinking about it is something called stratification. And stratification means that we're going to divide up different sets of patients who all have the same condition into different categories of severity. How serious is their disease? We're going to put some at the very severe end, and we're going to put some at the very mild end. So, prognosis or stratification are important things to do. They help us understand how much energy we need to put into helping the patient. Do we need to spend a lot of money in the healthcare system to help them? Do we need to do lots of testing? Does the patient need to have an appointment every week or every month? Or can the patient actually only be seen once a year? And that's important for the patient as well, because that's an invasion of their life to have to keep going into healthcare all the time. And most patients will tell you they don't want to have to keep going in for appointments. It's not particularly fun. It can be boring. They have to have investigations, have to be poked about. And so if they're told you don't really need to come into hospital that often, that is a much better finding for them. Labs can help with this, okay? Lab testing can be able to help prognose or stratify patients of different types of disease. And we can do that either at the acute medicine stage when we first discover something about a patient, or maybe at the secondary care stage if they've gone in to have a hospital appointment subsequently. The final option that a healthcare lab can do is what we call monitoring. This is where a patient has been given a diagnosis, they have a condition, and potentially we're going to now give them a procedure, we're going to give them drugs, or maybe we just feel like the patient's disease is not that severe at this moment, but we want to keep an eye on them. We may have a particular thing that we can measure. Sometimes we call that thing, a posh word for that is an analyte. Okay, it is a particular component of the body that we can measure repeatedly, and if we measure it, we can see how much there is, if there's too much, too little, what is the change since the last measurement. And that will guide us to know when should the clinical team act on the patient and change their medication, bring them in for another review, maybe move in to do another procedure, maybe even go the other way and say, actually, we've now monitored you and you've got to a point where we don't need you to be under our care anymore and we can discharge you. And monitoring happens particularly at this point where we keep patients in a home community setting and they potentially keep revisiting the specialist team just to be able to see how they're getting on. So you can see multiple areas of the healthcare flow system where healthcare laboratories can help. And this is why I don't want to know a healthcare laboratory as a diagnostic lab, because you can see there are multiple areas there. And I don't want to see us as a pathology lab, because a pathology lab is somewhere that only looks for pathology. And we know that pathology is effectively a term that says finding fault or error, or problem in a situation. Okay, so thank you very much for looking at this. I hope that's been useful for you. That's all I want to keep to on this. Please subscribe and like and comment on this and look for future videos that we're going to drive through, particularly talking about how labs fit into healthcare systems and how labs work and their mechanisms. Thank you, and I'll see you next time.